Jason asks, if we are planning to use MIPS CQMs to satisfy the APM Performance Pathway, the APP, how soon do we need to get started?
Great question, Jason. I'll stratify my answer into three sets of circumstances. First, those ACOs for which eCQMs are the most cost effective solution. Two, those ACOs for which eCQMs are feasible. And three, those ACOs for which eCQMs are not feasible. The answer for all three is the sooner the better. Now is not too early. But the rationale differs a little bit for the three strata. For the first two strata, those ACOs for whom eCQMs are the most cost-effective solution or at least feasible. If you're still struggling with this analysis, there are two resources where you might get some guidance. Medicare has published a guidance document discussing the APP reporting options and their strengths and respective weaknesses. Their document, entitled Reporting MIPS CQMs and eCQMs in the Alternative Payment Model Performance Pathways, is a good document with one of the most informed and accurate discussions I've seen from Medicare on this subject. You can find it on the cms.gov website, and we'll share a link to that along with this recording. You can also refer back to an answer I gave in a recent recording of Ask Dr. Mingle, Are eCQMs Right for Me? So let's hit them one at a time. First, eCQMs are the most cost-effective solution stratum. This might be if all participants in your ACO share the same instance of a single EHR. Your EHR supports the three submittable eCQM measures of the APP. They don't all support all measures. And your providers are skilled with your EHR and follow specified care documentation and workflows. Start now. The process of eCQMs is significantly different than the process of web interface reporting. We as healthcare providers are much better at finding chart data on manual review than we are at putting it in a standard location found by automated reporting methods. You want plenty of time to discover and correct anomalies in your documentation workflows. There are substantial scoring incentives to doing it early. And if your trial run of your eCQM shows unfavorable scores for 2023 or 2024, you can submit both eCQMs and web interface and enjoy both the incentives for early use of CQMs and get the benefit of the more favorable score of your two submissions. Second, the eCQMs are feasible stratum. If you think eCQMs are feasible, but you do not enjoy the narrow set of circumstances I outlined for the first stratum, MIPS CQMs are most likely to be your cost-effective solution. Start now. All of the advantages I listed for the first stratum are just as applicable to you. I have no doubt that if you apply yourself to the task with our guidance or the guidance of a similarly skilled registry, we can lead you to success with MIPS CQMs. If I were in your shoes, without the confidence that I have from years of experience with MIPS CQMs, I'd want to leave time to re-engineer to eCQMs if it proves necessary. And third and finally, the eCQMs are not feasible stratum. Most of you fit into this category. Your system is just too complex and too changeable for it to be affordable to implement and maintain an enterprise master patient index, to aggregate and normalize the EHR data from all of your participants, and structure, standardize, and retrain care documentation workflows for all your present and future ACO participants. MIPS CQMs is simply the most cost-effective method for most of you to meet APP quality reporting requirements, but it still takes some time and effort to optimize your results. There are two data streams to engineer and optimize. We will use your claims data to identify 100% of your patient population for each measure denominator. We will use your clinical data from multiple sources to identify enough numerator data to satisfy the data completeness criteria. It's doable. We have plenty of experience doing it, but the bigger and more complex your group, the more time it'll take to run down and correct each identified gap or error. Do yourself a favor, give yourself as much time as you can to get it right.